Health Info, bringing you well-researched medical information. Patients with diabetes have a lot of questions surrounding their medication. Today, we have compiled for you some common questions you may have around this topic. Please note that the information provided in this video is for educational purposes only. Any specific questions should be directed to your physician or care provider. So let's begin. Question: what is the best time of the day to take my diabetes medication? The time for taking medications depends on the frequency with which you are prescribed it. If you are given a once daily medication, try to take it with the same meal each day. If you have to take HT medicine twice daily, then you can take it during breakfast and your evening medication. Some drugs may need to be taken 3 times a day, which could be paired up with the 3 meals of the day. Always confirm if you need to take the medicines before or after food, and with food or on an empty stomach. I keep forgetting to take my diabetes medication. One of the best methods to make sure you don't forget to take your medication is to take it at the same time of the day and in the same location. Using a labeled pill box with times or days is also very helpful. You can get these boxes cheap at any drugstore. You can use these pill boxes to create your daily medications for a week. This way you will keep track of the days and times when you take medications. The pill boxes can be as simple as 1 pill slot per day, 2 slots per day for morning or evening, to 4 slots per day. Find the one that suits your needs. If you're concerned that you may forget if you took your medication, paste a paper with a calendar printed out and mark it as soon as you take it. That way you will not risk repeating or forgetting your medication. I forgot to take my diabetes pill. What should I do? It depends on the time, since you should have taken your medication. If you take the medication twice a day and are within the 3 hours of your regular time when you take the medicine, you can go ahead and take it. If more than 3 hours have passed and you have the next scheduled medication, then wait to take that. Don't double it, unless your physician specifically guided you for that particular medication. If you take a long-term medicine once a day, then you can take the medication even within 12 hours of missed dose. However, make sure you discuss with your physician what to do for your medications in case you miss them, as what we discussed are very general guidelines and may differ depending on your medication and level of glucose control. Should I take my medicine with or without food? It really depends. Some medications should be taken before food on an empty stomach. That is because if those medications are taken with food, they might not get absorbed, or may become useless and not exert the desired therapeutic or medical effect on the body for which they were prescribed in the first place. Other medications may be recommended after eating food. Therefore, always confirm with your physician. Usually it's a good idea to keep a small diary with your medications to check if you ever get confused about taking them. If I controlled my diabetes with diet, do I still need to take my medication or insulin if my doctor prescribes it? The short answer is yes. Medications are usually added after the effects of good healthy diet changes and exercise have been observed in a patient, and it was observed that the glucose levels were still not getting under control. Medicines help slow down the advance of complications that are associated with diabetes. The dose is dependent on the level of control that was achieved with exercise and diet, and is usually started with the lower dose possible. We hope these questions help you understand a little more about managing your health, indications, and diabetes. Remember to always consult your physician and pharmacist on the best way to take your medication, and what to do in case of missed dose or overdose. Keep watching our videos to learn more about new developments in diabetes. If you like our videos and want to learn more, please leave a comment below, subscribe and share to help others.